Hello and welcome back. My name is Joseph Tsuma, always your favorite doctor. And when you see me here, you know it is Matters Health. So I'm here to bring you trusted health information wherever you are. And you can follow us for simple, updated, practical, and reliable medical insights to keep you and your family healthy. You can subscribe to our YouTube channel at Dr. Will so that you are able to be notified every time we upload a new video. You can also follow me on TikTok at Dr. Itsuma. So today I want us to discuss a very important topic called arthritis. But before we dive into today's topic, I want us to listen to some words of wisdom from the book of Second Chronicles, chapter 7, verse 14. And the Bible says, "If my people who are called by my name shall humble themselves and pray and seek my face and turn from their wicked ways, then I will hear from heaven, I will forgive their sins, and I will heal their land." So let us dive into today's topic. What is arthritis? So the thing you need to know about arthritis is that it is a disease of the joint, or it's a condition of the joint. And what happens is in the joint you will have inflammation and you will also have degeneration. Okay, so degeneration is basically the wearing out of the joint. So it is a disease that affects the joints, okay? And at the joint, what happens is there will be degeneration or wearing out of the joint, okay, especially the cartilage. Now, when you look at the bones, especially at the joint, okay, mostly the long bones, that the knee joint, the hip joint, okay, at the end of the joint you have a cartilage, mostly hyaline cartilage. Now that cartilage basically helps a lot, especially with movement. Okay. Now with arthritis is that cartilage basically wears out. Okay, and as it wears out, it basically reduces the space between the two adjacent bones. Okay, and that's why one of the clinical features of arthritis is reduced joint space. So this joint space is reduced, and if it's reduced, it means that one of the presenting complaints will be stiffness of the joint. Okay, so the cartilage breaks down, and as a result, there will be a lot of remodeling of the joint. So the joint has gotten worn out, so it keeps on remodeling, and in the process, there will be some small bony fragments that will be growing on the joint at the end of the joint, what we call osteophytes. Now, this is the reason why people feel pain. Okay, so there will be stiffness because of the reduced joint space, and those two small bone fragments or those osteophytes basically will lead to pain, especially when you start moving, okay? And also there will be reduced function. Now, arthritis affects mostly, it's one of the major joint conditions worldwide, okay, in that it affects both male and female, but research has shown that women are at a higher risk, especially women that are above 50 years of age, okay? And we have joints that are more prone to arthritis, okay? So we have mostly, the first joint that is mostly affected is the knee, and then we have the hip joint, and sometimes you can have joints of the hands, okay, and even joints of the spine, okay. And of note is that the risk of getting arthritis basically increases with age. So as you keep on aging, your risk of getting arthritis basically increases. Now, before we go into what are some of the risk factors, I want us to discuss the types of arthritis. So we have at least three common types of arthritis. Okay, there are many, but for these purposes, we will look into three. So number one is osteoarthritis, okay, which is basically as a result of age, wearing and tearing, okay, as a result of overuse or persistent use of that joint, okay. And then the second type of arthritis is what we call rheumatoid arthritis. Now rheumatoid arthritis is as a result of autoimmune, okay. So basically your body produces antibodies, okay, to fight something, okay, in the body, but then it ends up fighting the joint. So basically it attacks the joint, and especially the cartilage in the joints, and basically you end up having wearing and tearing of that joint. And then the last one that will be of focus is what we call gouty arthritis. Now, gouty arthritis is as a result of deposition of uric acid, especially in the joints. Now, we are going to have a deep discussion about gouty arthritis probably in a different video, but for this we will be focusing on osteoarthritis. Now, what are some of the people, or what are some of the risk factors? Okay, so we have what we call the modifiable risk factors and the non-modifiable. Non-modifiable are those things that you do not have control over. Like, for example, we say that female are more affected than males. Okay, the sex. So basically, if you are a woman, you are already a woman, you cannot change that. Okay, and then genetics, okay, and then congenital abnormalities, like people who have been born with congenital talipes they are at much more risk of developing arthritis than when you have just been born without any abnormality. Now, when we look at the modifiable factors, this is where now the gist of this topic is, because now if you know the modifiable factors, it means if you are able to modify them, then it means you are able to reduce the risk. So number one is obesity. Okay, so basically huge weight. Okay, and then history of trauma. So if, let's say, for example, you had an accident and you actually had either fracture dislocation at the joint. Okay, so during the process of healing and remodeling, you are running a risk of developing arthritis in that joint. And then repetitive stress. Okay, so basically if you're using one joint for a very long time, okay, it's easier for you to basically develop arthritis. And then of course sedentary lifestyle, whereby you don't do any exercise, you move from the house to work and then from work back to the house and you're driving, therefore you don't do any exercise of your joints. Okay, and then of course in cases where the muscles are weak, what we call laxity of muscles and laxity of the joint of the joint. So those are some of the risk factors that you need to be aware about. Now, how do people present? So of course, pain at the joint, okay, associated with stiffness, okay, and the stiffness is basically severe in the morning, okay, and then when you squat, okay, especially when you squat and then you're trying to wake up from squatting, okay, you will hear some crepitus, or like some crashing sound that comes from the joints. Okay, that one basically is a sign. If you can't squat, especially if you're using the toilets that you have to squat for you to help yourself, and as you wake up from that squatting position, okay, you hear some crackling sound, okay, from the joints. That one is actually a sign that you might be having osteoarthritis. And then of course swelling of the joints, okay, and also reduced range of motion. So you're trying to stretch your leg but you're not able to fully stretch it. So by far those are the basic uh, symptoms of arthritis. Okay, now, so we say that the joints that are commonly affected are the knee joint, okay, but you can also have the hip joint, you can have the joints of the hands, and as well as the joints of the spine and the feet. Now, how do you make a diagnosis? Of course, clinically, okay, so we'll listen to you, we'll also do the examination to be able to ascertain exactly what is happening. And then the other thing we can do is we can do an x-ray. So basically the x-ray will basically show reduced joint space or narrowing of the joint, okay. It can also show some sclerosis. We talked about remodeling, okay, constant injury of the joint, okay, that basically will lead to remodeling. So we can see some sclerosis, but also you can see the osteophyte, those small bony fragments that are trying to grow at the joint, and even bone cysts, okay. So those are the clinical features on an x-ray that you can see and say this joint basically has an arthritis. Oh, and then the other thing is we basically go ahead and as well do some lab works to basically rule out the other types of arthritis. We talked about gouty arthritis, so we look at the uric acid levels, and for rheumatoid arthritis, we sometimes do the rheumatoid factor to be able to ascertain whether it is osteoarthritis or rheumatoid arthritis. Now, how do we manage? So management is three-way. Okay, so we have medical management, surgical management, and then we have physiotherapy. Okay, so physiotherapy by far is the best management. Okay, because it's not medical, and if you can master it, then you can actually reduce the progression of arthritis in your joints. Okay, so medical management, of course, we need to first of all reassure and tell patients that this is a chronic disease. Okay, it is progressive, and therefore you need to put in some efforts to be able to halt the progression of this disease, okay, and also help to improve the life and improve the outcome of it, okay. So patients education very important, and then we advise patients on weight reduction. If you are obese, you need to do a lot of exercise to help reduce that weight, because that weight is transmitted all the way to the joints, okay. And if it's transmitted to the joints and the joint is already having some issues, then therefore it will actually become more and more worse, okay. And then we say the second thing is physiotherapy, okay. So exercising those joints, okay, and sometimes we advise on assistive devices to be able to help. And then in physiotherapy also we have what we call heat and cold therapy, whereby you are subjected to thermal heat, especially on the joints, to help with reduction of the stiffness, but also increasing the range of motion of that joint. Now, what are some of the medical management that we normally give? Of course, we give painkillers, okay? So we have some painkillers that help to reduce inflammation, but also they help to block the pain pathway. So then you are able to be pain-free, okay? And the common ones are the non-steroidal anti-inflammatory drugs like diclofenac, brufen, okay. And then for severe cases, sometimes we do intra-articular corticosteroids. So these are steroids that we inject in the joint to help reduce inflammation, okay, and they have been shown to be very effective, okay. Now recent studies have shown that you can also inject hyaluronic acid injection. So basically this one helps to kind of like help to rejuvenate and regenerate the cartilage, okay, but there is limited role of these injections, especially when it comes to management of osteoarthritis. Now when it comes to surgical management, number one is you can basically do a joint replacement, okay. So if the joint has been badly damaged, okay, we can go ahead and actually do a joint replacement, either a knee replacement, a hip replacement, so that you're able to increase the range of motion and reduce the pain that comes with it. What are some of the complications? Of course, chronic pain and disability, okay? And then reduced quality of life. These people will not be able to be very productive, okay? And in some cases, if the counseling is not well done, these people can go into psychological, they can have some psychological problems because of the pain, okay? And in severe cases, the person will lose their independence, so they will always be dependent because they are not able to move, okay. And because of that, because of the pain and stiffness of the joint, okay, this basically increases the risks of fall and actually risk of fractures. How do we prevent? Okay, so number one is maintenance of healthy weight and healthy lifestyle, okay, a lot of exercise, okay, reduction of that extra weight, okay, and basically you should be able to manage that, okay. And of course, regular physical exercise helps to increase the range of motion. It helps to make your joints much more active, and therefore reduces the risk of you developing arthritis. And then avoidance of overuse or stressing the joint. And of course, early management of injuries. We talked about injuries or trauma as one of the major causes of arthritis. And then of course, calcium and vitamin D plays a very important role. Now, by far, that is what you need to know about arthritis. Now, if you're new here, please consider subscribing to our YouTube channel at Doctor on Wheels. You can also visit us at our hospital. We are located at Loops Hill Center at VET in Ngong, okay? And that is our premier hospital, and we'll be able to attend to you. Until next time, God bless.